Good morning, folks. It's the weekly update. I hope that these updates are serving you well and we're keeping you informed about things that are going on. Yesterday, that was my kitty cat. Yesterday, you heard from Peggy Foster, our Chief Operating Officer, and Denise Ellis, the Chief Personnel Officer. They've been working for the past couple of weeks on figuring out what our reopening strategies would be. And they spoke with you about some of the phasing in that we're going to be doing and how we're going to be doing it and where and who and things like that. They're actually going to be publishing that very soon in a written document. I know it was a lot to hear all at one time, and sometimes I have to sit down and actually see things in writing to figure out actually what was being said. But we have to remember that this is a very fluid situation. We almost hate to put things down in writing because it may change the next day. And it needs to be fluid because reopening is not etched in stone anywhere. It depends on the virus, and the virus has a mind of its own, and it's not gone. People may be thinking that, well, things have opened up, the virus must be gone, and everything must be okay. And indeed, what I saw pictures of over the Memorial Day weekend made me actually think, do people really think that the virus is gone? It's not gone. As a matter of fact, we could be seeing ahead of us a kind of a resurgence. As a matter of fact, yesterday in South Carolina was the highest number of deaths that South Carolina has experienced so far, 20. And that's a lot. So communities may be opening up. Beaches, restaurants, everything may be opening back up. But trust me, the virus is not gone. It is still here. And we have to be very, very careful. We watch the data. You know, we still have that task force that's going on. We still meet. We don't meet quite as frequently as we have been doing, but we are still meeting. We're working around the testing events that we're doing with the Department of Health, and I'll get to that. But we are still meeting, and we have someone on our executive management team, John Douglas, who is the Chief of Business Development, who loves data, and he's been publishing a digest. We've been furnishing that to y'all. I know it's a lot of information, but when you look at it, you'll see that there is some various input from different entities, but they're all saying the same thing. The virus isn't gone. And we could easily be experiencing in a couple of weeks or so a resurgence. So the message is to be very, very clear. Be careful. Don't think for 1 minute that we have to relax our masking, our temperature checks, our social distancing, all of that remains in place. So, back to testing. We are, in collaboration with the Department of Health, going to be doing some pretty large testing events. I think my cat has decided to go absolutely bat fool crazy. Could I ask someone to come and pick her up? I don't think that people can hear over all of that noise. But anyway, we were scheduled to do a large testing event on Friday, which is actually you are seeing this on Friday, and we're not doing it. I'm not there. So because we looked at the weather and we began to realize that with the possibility of that much rain coming in, that we really were going to have a mess. So we talked with the Department of Health, and they agreed that testing over in Latta, we were doing it at the elementary school, was probably not a very good idea with the weather forecast to being what it is. But we rescheduled that testing event to next Wednesday, June the 3rd. Now, the Department of Health, DHEC, told us if we reschedule it, folks, we can't help y'all. But we said, that's okay, Department of Health. We're going to do this on our own. As long as y'all can provide us with the necessary supplies, like the testing kits that we need to collect the specimens, as long as y'all can provide us with some PPE, personal protective equipment, the mask and the gowns and everything, and as long as y'all can make sure that we can get those specimens safely to the DHEC laboratory in Columbia, we got this. And DHEC said, yes, Carousel, we think you do. We trust y'all. We've done 2 big testing events with you. You are a great partner, is what DHEC told us, and we're going to let you go solo. So, folks, don't let them down. We not only will be doing that testing event in Latta, but they also agreed, and going forward, we'll be doing additional testing events. We have one that will be scheduled in Bennettsville. We will be doing it at the Northeastern Technical College site that's there in Bennettsville. It's on Highway 9, and folks know it as the old Winn-Dixie. It's a nice space. It's got a big parking lot, and you can circle around it. And that will be the following week. I believe the date is June the 9th. And then we're going to move to Chesterfield. And at the Chesterfield High School, we will be doing another event on June the 18th. I think that's correct. Maybe you shouldn't hold me to those dates, but just watch and pay attention on Facebook as you see that we're promoting these. DHEC is still supporting us with all of our needs, but they're giving us quite an amount of, shall we say, goodwill, and understand that we pretty much have learned what we're doing. Our goal is still going to be testing as many as 500 at each of those events. So we'll be working hard. We've had teams that have come from the front offices around the organization. We have teams that have come from the laboratories, nurses, and community health workers. Actually, a lot of folks have chipped in to not volunteer, but to be part of these events. And it really is showing. Y'all are a fabulous, fabulous staff to work with. The Department of Health is seeing that, as does the National Guard, and frankly, all the other community partners. So this is I kind of consider this a real honor that DHEC has given us the blessing, so to speak, to go ahead and do this on our own. Thanks to y'all. Thanks to how you have convinced them that we got this. We know what we're doing, and that allows DHEC to go out and support other events in other areas of the PD. We need to, across South Carolina, improve the numbers of folks that can be tested. We know that will reveal a lot of folks that are positive, but they probably didn't know that they were positive. And in knowing that, they will be able to limit their contacts, they'll be able to self-quarantine and isolate themselves, and that's very, very important. So let's all do our job. Let's see if we can't get the active number of cases down. You'll see that when you look at the report that John Douglas does that I mentioned earlier. You'll see that unfortunately in the PD area, in our 5 counties, the number of active cases is still climbing. And those are cases that people are still sick. They haven't recovered. So that's a very important number. Let's see if we can't get this number down. Let's see if we can diminish the number of deaths that are in the PD. And let's continue to be a good partner to not only DHEC, but also to others that are asking us for their support. We helped out the Darlington County Sheriff's Department. We're going to be helping out the town of Sherrall. We're going to be doing some more active testing, as a matter of fact, in Sherrall, although not a big testing event. but we've worked out a way to be able to bring testing there. Since we don't have a parking lot, so to speak, of at our Sherrall office, we've Randy Carlisle and other folks have worked really hard. So as we do these testing events and this drive-through testing that we continue to do at our own sites, we're playing a very important role in the community. We're helping identify folks that are positive, that may not know that they're positive, and we're being a good partner to our friends and our associates that are in the communities. So keep on, CareSouth. You're doing a magnificent job. You'll hear more from other folks as we beef up our communication plan with everybody to let you know what's going on, who's doing what, where it's happening, and when it's happening. So stay tuned, and thanks for listening to me today. Have a very good and very safe weekend. Thank you. All right.
Yeah.